What is the difference between a diastasis and a hernia? Well, both are things that can cause an abnormal contour of your lower abdominal area or your entire abdominal area, depending on how severe it is. However, there is a distinct difference between the two. Diastasis, also known as diastasis recti, is just a fancy way of saying separation of your abdominal muscles. Well, which muscles are they? Typically, it's your six-pack muscles, and those muscles are called the rectus abdominis muscles. Those muscles typically get stretched either during pregnancy or if you're obese for a long period of time. That can separate the muscles from the midline of your body, and in between that, there's a thin layer of fascia. Now, that fascia doesn't necessarily have a hole, it just gets very thin and stretched out. Over time, that stretched out fascia can become more of a bulge. And that could be your organs or your intestines kind of pushing through that thin layer of fascia. That's what's giving you an abnormal contour. On the other hand, a hernia or an abdominal hernia is a hole through that fascia. And sometimes you can have both a diastasis, meaning thin fascia, and a hole through that thin fascia. And typically, the bigger the diastasis, the more likely that you'll have fascial defects or holes through it. Now, what's the main difference and how do you treat it? Well, a hernia is basically a hole, and depending on how big it is, it can cause pain, it can cause disfigurement, and sometimes it can affect your bowel habits, like going to the bathroom or passing gas because your intestines are blocked. In those scenarios, you might need a surgery to correct that, and depending on how severe it is, it might actually even be an emergency. Now, typically, this can be done with a general surgeon, and if you're interested in a tummy tuck at the same time, it depends on where the hernia is and how severe or how big the hernia is in order to safely do it at the same time. Now, sometimes a diastasis is so big and the fascia is so thin that there's many little small hernias that can be addressed. And again, depending on where that is, you might be able to address that at the same time as a tummy tuck. Now, oftentimes, during a tummy tuck, there are small hernias that are around the belly button. That's known as an umbilical hernia. Typically, this can be corrected with either just suture or permanent suture. And once it gets to be about more than 2.5 centimeters, sometimes a mesh is necessary. And in those more severe cases, you might need a general surgeon to help put that in and to continue to follow up with you after surgery to make sure it doesn't recur. Certain risk factors like obesity are a huge risk factor for recurrence of hernias. That's why it's important to keep your BMI low, less than 30, and maintain a healthy lifestyle before you ever consider having a hernia surgery, especially if you're trying to have that at the same time as a body contouring procedure like a tummy tuck. Nowadays, with GLP-1s, medical weight loss is a little bit more achievable than it used to be. Historically, with bariatric surgery, having an incision from surgery can also contribute to hernias, and that's another factor or risk factor for not only hernia development, but also hernia recurrence. To see if you have a hernia or if you're a candidate to have a hernia repaired at the same time as a tummy tuck, or if you have a diastasis or a combination of both, call the office. I'd love to see you.